What postpartum lower body exercises are safe for hip instability? Imagine feeling confident moving again after pregnancy. If your hips feel unstable or sore, you might wonder which exercises are safe to rebuild strength. Well, you're in the right place. Let's explore gentle yet effective ways to support your hips postpartum. After pregnancy, your body releases a hormone called relaxin. This hormone loosens ligaments to prepare for delivery, but it can leave your hips feeling loose or unstable afterward. Carrying extra weight and changing movement patterns can also weaken your hip muscles and ligaments. The good news is that targeted exercises can help rebuild stability safely. Start with foundational moves that focus on activating your deep core muscles and strengthening the muscles around your hips. Gentle pelvic floor exercises are a great place to begin. These can be done lying down, sitting, or standing as you get stronger. They help your body learn to coordinate your core and hip stabilizers. Next, try bridges. Lie on your back with knees bent and feet flat on the floor. Push through your heels to lift your hips toward the ceiling, squeezing your glutes at the top. This move strengthens your glute muscles, which are key for keeping your hips stable. It's gentle but effective and safe early on. Clamshells are another excellent exercise. Lie on your side with knees bent and feet together. Keep your feet touching and lift your top knee away from the bottom one. Lower it back down slowly. This targets your outer hip muscles that help keep your hips aligned. As you progress, introduce exercises that build strength in different directions. Staggered stance squats with a resistance band are good for strengthening your inner thighs and improving pelvic stability. Loop a resistance band around your knees, step one foot back into a staggered stance, and lower into a squat. Keep your knees over your ankles and push back up. Step-down exercises are great for single-leg stability. Stand on a low step or platform, then slowly lower your opposite foot toward the ground. Keep your core engaged and your hips level. This movement trains your hip stabilizers to work independently, which helps with walking and climbing stairs. Lateral walks with a resistance band are also helpful. Place the band just above your knees or around your ankles. Step sideways slowly, maintaining tension in the band. This strengthens the muscles that keep your pelvis steady during daily activities. Once you have built a solid base of strength, you can move on to more advanced exercises. Single-leg Romanian deadlifts improve balance and hip mobility. Hold a light weight or no weight at all, hinge at your hips, and lift one leg behind you while keeping your back flat. This targets your glutes and hamstrings. Goblet squats are another good move. Hold a weight at your chest, keep your core tight, and squat down. Exhale as you stand back up. This helps coordinate your breathing with pelvic floor activation and adds gentle resistance. Walking lunges are excellent for building strength and balance. Step forward, lowering your hips until both knees are bent at about 90 degrees. Push back to standing and switch legs. This movement prepares your hips for more dynamic activities. Don't forget about stretching and mobility work. Hip flexor stretches can release tightness from pregnancy. Kneel with one foot forward and gently reach overhead to stretch your front hip. Cross one ankle over the opposite knee and pull your bottom leg toward your chest to stretch your outer hip. Addressing tight muscles is just as important as building strength. Gentle back rotation stretches can help with spinal mobility and prevent compensatory movement patterns. Lie on your back, knees bent, and gently drop them to one side while keeping your shoulders on the ground. Always listen to your body. Avoid bouncing, jerky movements, or exercises that cause pain. If you experience discomfort, stop and modify the exercise. Maintaining good posture during all movements helps prevent additional strain. Start slowly and gradually increase the difficulty as your hips get stronger. If you had a cesarean or experienced complications, check with your healthcare provider before beginning any new exercise routine. In the first few weeks postpartum, focus on pelvic floor activation and gentle walking. As you feel ready, add in bridges and clamshells. By about 4 to 8 weeks, you can incorporate squats, step downs, and lateral walks. After about 12 weeks, more challenging moves like deadlifts and lunges can be introduced. Working with a physical therapist can make a big difference. They can assess your specific needs, correct your form, and help you progress safely. Remember, patience and consistency are key. Your body has gone through a lot, and with gentle, targeted exercises, you can restore strength and stability to your hips.